Here we are to discuss my next journey, which is a bit scary but very necessary. I think the scarier thing for me is not taking the journey. As most of you know, I've been a very active person, so this came as a complete surprise. I had no idea I had a heart problem. I've been active for 14 years now with scuba diving, and probably even longer than that with hiking. And since we moved here to Albuquerque 8.5 years ago, I've been very active with a hiking group here, doing lots of mountain exploring and hiking on trails, as well as visiting the Grand Canyon, Arches National Park in Utah, and lots of other sites. So finding out this past year that I had a heart murmur came as a bit of a surprise. It's funny how you take some things for granted. Sometimes you think it's just, well, it's a strenuous trail, maybe that's why I'm out of breath, or maybe that's why I'm tired, as we did so much hiking yesterday. I had no idea that it was more than that. So when my doctor said, hey, I see a problem, I was quite anxious. And it all began last year with knee problems. I've had knee problems for 30 years. Since college, I was active in some sports back then, injured my knees over and over. So continuing knee problems for 30 years never seemed like such a big issue. But by the problems I was having this year, seeing my doctor over and over with a recurring knee swelling problem, he discovered that I had the heart murmur. The first thing he noticed was I had a pulse visible in my neck. My neck was, with every heartbeat, my neck was pulsing out. You could see the artery moving. And I always thought that was because I was hiking so heavily, but just sitting in the doctor's office, it was pulsing. And he said, nope, that's not normal. That's usually backflow from your heart. You need a cardiologist. So in November, this past year, I went to see a cardiologist, and he discovered I had a mitral valve problem. I have a mitral valve prolapse, and that's not that uncommon or bad for you in most cases. However, mine is severe. I have severe regurgitation, which means that the blood is backflowing about as much as going forward. So my heart is having to work overtime, and especially with my strenuous hikes I've been doing lately, I was definitely having some issues. And by summer, my constant exhaustion after hiking, or even sometimes during hikes, was increasing. I was getting really, really tired a lot. And so when the doctor said this was the cause, it was a big aha moment and a big oh my God moment. Now what? So the doctor and I agreed that probably my heart is starting to show the wear and tear from this problem, and I am starting to show symptoms, which means eventually I'm going to have my valve fixed anyway. So rather than waiting until who knows what crisis occurs and where I might be, we decided to go ahead and fix it now. I'm in pretty good health, really. I have been up until 6 months ago pretty active, going to the gym, going hiking, carrying on a more than average activity level for someone 56 years of age. So that is a good thing. So I'm a few days out from my surgery. I'm scared, but as I said, I'm more scared of not having the surgery. I definitely feel like my heart is starting to fail. So I've had several tests, all to check my heart and my arteries and to make sure there's nothing else going on. And everything looks good. My arteries are clear. Looks like all my other valves are working fine. It's just the mitral valve that's the problem. And it could be I had rheumatic fever as a child, or it could be that I was born with a bad mitral valve, and because I've had it all along, we never really thought anything, that I got tired easier. Or it could be it's just gradually wearing out due to damage previously. So I'm a couple days out from my surgery. I'm having the surgery done at UNM Hospital here in Albuquerque on Monday, February 25th. So I will be talking to you after my surgery and let you know how things go. Currently, the doctor believes that he will be able to do this minimally invasively, which means they will cut on the side of my chest and go in between my ribs, cut open my heart. It's still open heart surgery, but they'll be able to stop my heart, hook me up to the heart and lung machine, cut my heart open, sew the valve, cut and trim this valve where it's floppy right now, sew the leaflets back where they're supposed to be and tighten it back up, and then sew me up, and I could possibly be back at my regular schedule in a month to 2 months. If that doesn't go as planned, if for some reason he does not feel he's able to do the surgery that way, then he will have to do the standard chest sawing, crack open surgery. We're hoping he doesn't have to go that way, primarily because of the recovery time. That one's a 3-month or more recovery time, so it could be a little bit more physically demanding on me, and so we're hoping he can do it minimally invasively. That's the plan up until surgery day, but you never know what might happen during the surgery. So I may go in thinking I'll have a scar here. I may wake up with the full chest scar. Either way, as long as he fixes the heart, I'm good, because I have lots of things left to do. So I think that's all for now, and I will be talking to you again possibly Tuesday. I'll be feeling up to saying hello and let you know how the surgery went.